We're here today at Trinity Health to talk about a common issue, dizziness. But can you define what dizziness is? Well, Dr. Corey from Trinity Health, he is an expert in neurology and can help us do that. Good morning.
Good morning.
Thanks for being. Thanks for having us here,
Sure.
I should say. When patients come in and they say, I'm feeling dizzy, that's such a vague concept.
Right.
How do you define the problem?
Right, yes, right. So dizziness can mean a bunch of different things. So they'll say dizziness when sometimes that means I'm falling or I feel like I'm going to fall or the world is spinning. So I break it down into four different things, right? One is vertigo. Vertigo is a sensation of moving when you know that you're not moving. Either the world is moving or I feel like I'm moving, and it can be a spinning, it can be a rocking back and forth, it can be a sliding or moving up and down. It can be any one of those things. But vertigo is a sense of motion when you know there's no motion.
Okay. For some reason, I've always confused that with like a fear of, I think the Alfred Hitchcock movie maybe had done it for me. So you're saying they're standing still, but it feels as though the world is sliding or rocking or
That's
moving,
right.
even though they aren't.
That's right. That's right. It feels like the world is moving or that they're moving when they know that they're not.
Okay. And how else are you going to describe that? You're going to say, I feel dizzy.
That's right. That's right. That's right. But the technical term is vertigo.
Okay.
Right? Okay. So that's one. The second one I like to talk about is wooziness. Wooziness is just a vague sensation that my balance isn't as good as I would like it to be. Okay. And so for wooziness, it's like you're on a boat that's going up and down, you know, right before you get seasick. Or it's like a sensation of, it's like being slightly intoxicated or having a little bit too much to drink, where you feel like you're not quite at your best.
Does wooziness maybe sometimes affect your stomach? Maybe feel like you
Right.
mentioned seasick, and when I hear
Right.
the word woozy, it tends, I always, for some reason, think of the gut.
Right, yeah, that's right. That's precisely right. So the people think that nausea is one of the things that happens with many of these forms of dizziness. It can be wooziness, but specifically with vertigo and certain kinds of nausea help me figure out whether something is, what the cause of it might be.
Okay. So wooziness is different than vertigo, and vertigo is different than lightheadedness. You hear that from
Precisely.
time to time where you're just like, I
Right.
feel a little lightheaded. What,
Right. What is that?
Yeah.
That's a sensation that there's not enough blood flowing to your head, that you might pass out, that you might, that you're just, again, not getting enough blood flowing, and you feel like, oh, I'm a little bit off. Mm-hmm. Right.
So that sometimes people get that inner ear sensation when they're changing altitudes, getting up from seated position to the top. They might get that
Yes.
that type of feeling, that lightheaded feeling.
Yes, it's a lightheaded feeling that happens. That's right.
Okay.
Yeah, and it's often an inner ear thing, but usually it's we'll get into the causes about that.
Oh yeah, because we're going to dive into all these because you're looking at wooziness, lightheadedness,
Right.
vertigo. Are there any more ways you could say you're dizzy?
The last one is imbalance. And
Okay.
that's the feeling that I'm going to fall. I'm going to lose my balance. So when I talk to patients, and I will talk about all these four things in detail, and then I'll say, and then I'll review them very quickly, and I'll just say which of these four, and it can be more than one at a time, sound like the things that are affecting you.
So how does Trinity Health treat dizziness? I mean, we're treating vertigo, treating these different ways that people might get injured.
Right, sure. Yep, so the first question is to ask them which type it is, and then to ask them a lot more about their other different kinds of symptoms that they're having, right? So are they having other neurologic symptoms? Are they having numbness or tingling? Are they having nausea? Are they having any change in their vision? Are they having any problems with headaches? And that's a common one as well. And all those things are very important. So if we take a look, for example, at vertigo, what the causes are, that's one of the more common symptoms, and many people have different kinds of things going on in the brain or the nervous system or the body that are contributing to that.
Is somebody watching this right now thinking that could be me? I'm having some of those
Right,
symptoms.
right.
Where's a good place for them to start?
Right. So something that happens like that's very often, that kind of patient's often referred to an otolaryngologist, an ear, nose, and throat specialist, and that person helps to figure out really what's going on with if there is an inner ear problem. And they really are the experts, really most of the time, at figuring out whether there's an inner ear issue.
Well, if you are dizzy, lightheaded, woozy, maybe suffering from imbalance, there's a lot of different ways to describe dizzy.
That's right.
There is a place that you can go to learn if it's well, you mentioned things like peripheral neuropathy with that tingling and then things like
That's
that.
right, that's right, that's right.
So this is a place where they can go to get, what does a diagnostic appointment look like?
Right, sure. So they'll come in and see us. We'll talk to them, take a very careful history. They come in and we discuss those different 4 kinds of dizziness, which ones it might be. We'll do a very careful neurologic exam and find out what other kinds of symptoms are going on with this, right? And then what other signs that they have. You know, do they have numbness in the feet? Are their eye movements moving in such a way that it suggests that there's an inner ear problem or a brain problem? And that can help us figure out where to go from there. And I think the most important thing for patients to know really is the most severe consequence that you can have, the most severe cause that you can have from one of these problems is a stroke. A stroke can produce vertigo. A stroke can produce a lot of these sort of symptoms. But now we have medications that we can administer by infusion that can break up a clot that's causing a stroke. So if you do have a sensation of dizziness or vertigo with the world spinning around, and you have numbness or tingling or difficulty with speech or double vision or blurred vision or something like that, and these come on all of a sudden, we do have to think about a stroke. And the thing to do really is to dial 911 and get an ambulance ride to your local emergency department so that you can be evaluated in case there is a stroke.
And all of this information is waiting for you online at trinityhealthmichigan.org/neuro if you want more. Thank you so much for the time, Doctor.
My pleasure. Thank you.
Are you interested?